I'm Laura Blumenthal on the Berkshire Heroes podcast, and joining me today is Matthew Callow, a psychiatric nurse. Welcome, Matthew.
Thank you, Laura. Nice to be with you on this sunny afternoon.
Now, you are also studying for a professional doctorate in mental health nursing,
That's
but
great.
begin by telling us, what does a psychiatric nurse do? Who is it that you support, and what led you to your career path?
Well, that's a very good question, and it's a question I get asked quite a lot. What do we do? Some people they say, "Are you psychiatrists? Are you psychologists? Are you like social workers or what have you?" Um, the work we do falls into two categories, I suppose. The first is the role of the care coordinator, where we assess. Identify resources to help people implement care plans and then review the care that people are receiving. So from that perspective, there's a lot of work that psychiatric nurses don't actually provide themselves anymore. It's under the guise of social services these days. So we're there to make sure that things are happening. As part of the care coordination, we also assess and manage risk as well. We spend a lot of time and devote quite a lot of mental energy to keeping people safe. And it's something, when these things go wrong, which they do occasionally, it causes a lot of stress and worry for us. So we put a lot of time into preventing people from harming themselves, other people, or for being harmed, say, through neglect from other people. So that's one component of what we do. And then the other component is the direct interventions that we give ourselves. So we spend a lot of our work is about engaging with people, helping them to explore the difficulties that they've got. Sometimes they can be long-standing difficulties. And we use sort of psychologically informed approaches to do that. So, for example, in the postgraduate studies and things that are open to mental health nurses, there are a range of different interventions that we learn so we can add sort of more strings to our bows, as it were. So, for example, I'm qualified in doing family work, family therapy informed work with people, brief solution focused therapy. A lot of my colleagues have got training in cognitive behavioural therapy, which is quite popular these days and very good. And then there's the more traditional things that nurses do, such as assessing and monitoring people's physical health, supporting them in taking medication, dealing with the side effects, negating the side effects. So that's basically, I suppose, in a nutshell, what we do. I've been described quite a bit as a jack of all trade, which we don't really like that because the other side of that is jack of all trade, master of nothing. But we are masters of caring for people. And one of the big skills that you need for this kind of work is to be able to engage with people quite profound depths very quickly, people who are in distress, people who've got a distorted perception of reality, and to be able to build that rapport with them. And sometimes people can be quite hostile. Sometimes the distress can be quite difficult to overcome, to help them to overcome. So our interpersonal engagement is a big thing of what we do. And we have to be quite creative in how we work as well, because everyone is very different. Mental illness manifests different in different people, even people with the same sort of diagnoses. So we have to find ways of overcoming these problems. And we work as a part of a multidisciplinary team as well. As I've said already, social workers, psychiatrists, occupational therapists, and we link in with other specialist care services as well.
And have you always worked as a mental health nurse? I know you're based in the Reading area, but I don't know if you've had a previous career or this was always a path you wanted to be on.
It was. I kind of describe it as an inevitable path that I'm on, an inevitable career path, because when I was a child, my father had quite significant mental health problems, and he stopped working when I was 5. So I became a child carer, and that was in the not so good old days before there was carer support, recognition of child carers, and the available support. So I've essentially been looking after people with mental health problems since I was 5 years of age. And because of the services that my father accessed, I was socialised around people with mental health problems, severe mental illness, with mental health professionals. So it was basically my world. And growing up and thinking about a career, it really didn't take too much thought. It was just a progression of basically what I was doing already. So when I did my nurse training, nothing was especially shocking to me. I thought, seen it all before, really. but I was able to. I've always been able to use my empathy, understanding, and experiences in that respect. So it's become a life's work. As challenging and stressful as my childhood was, it did give me a purpose in life. So I'm kind of grateful for that. I don't know what else I would have done. But I mean, I've had a few different jobs. I worked as a gardener briefly. I did an apprenticeship when I left school. I've worked in supermarkets and things, but most of my working life has been within the NHS. It's pretty much all I know, really, but I do love it.
And to become a mental health nurse, do you essentially do just a standard nursing degree and then you can specialize later?
Well, when I did it, it was 2000 to 2003. I did my training. It was still possible to do a university diploma in nursing. So I got the diploma of higher education. Back then, we did a year and a half called a Common Foundation programme, where you are exposed to all the other branches of nursing and have placements in different areas. And then the final year and a half, you just focus on your speciality. So when I finished my training, I continued to do part-time studying, and I topped up the diploma to a degree, and then I continued to do a master's degree, and now I'm doing a doctorate.
And we talk about mental health all the time in society. Well, what are you seeing on the ground, and what do you see that's actually working and helping people?
It's probably important to say that the majority of people who struggle with their mental health are looked after in primary care by their GPs, by services like sort of local talking therapy, NHS services. So the people we look after in the more acute side of mental health, in community mental health teams, they're actually a relatively small number of people who are very, very acutely mentally unwell. They have what we call severe and enduring mental illnesses like schizophrenia, personality disorders, schizoaffective mental illnesses. So what's going out there on the ground in society? Surprisingly enough, maybe I'm not terribly astute as to what's happening out there, but I know sort of anecdotally from just being a citizen of this great country of ours, that I know that people are getting more stressed. People are finding life so difficult. And this isn't a new thing. I think this has been going on since the financial crash, actually. People have been struggling so much economically since then. Life has become harder. Life has become much more challenging. People aren't free to flourish. They don't have the financial resources to flourish, to support their families, and to prosper in life the way they would like to and should be able to. So that was a problem, and it was quite a landmark thing. And then also COVID as well, the pandemic. I mean, not just sort of looking out at the world and the deterioration in mental health. Even the people I was working with, who were struggling awfully throughout the pandemic as well. I think it's had a lasting effect. This is just my experience anecdotally. I see young people becoming more and more anxious. They're struggling to reflect psychologically on their experiences, and they just can't fathom why they're thinking and feeling certain ways that they don't deem as helpful or distressing. So I don't think the mental health of the nation is very good. I don't think we're alone in that in this country. And also the sense of belonging as well. I think I've seen this getting worse throughout most of my career, is that people are becoming more isolated, more lonely. They don't feel as though they're part of something, part of a community. They don't have the group identity. It's like my neighbourhood here in Reading. I don't know hardly anybody down my street. If I was to become poorly, sick or distressed, no, none of my neighbours would notice because I don't know them. And I think that's actually normal now. So there's a lot of things wrong with society at the moment.
And when it comes to young people and them increasingly struggling, what do you put that down to at its core? Is it that isolation and loneliness? Because it seems as if we've got much better mental health care and drugs than ever better before. There's less of a taboo about talking to about mental health. And also employers and schools are a lot more supportive than they were even, say, 10 years ago. And you think about our grandparents' time, our parents' time, there have been tough times throughout the whole of humanity.
Yeah.
What is it at its core that's really going wrong here, Matthew?
As I say, I think the sense of belonging of young people, I think young people are quite lost. I really do. They want to understand what's going on for them psychologically and socially, but they don't have the language to describe it. They don't have the frameworks in their mind to be able to reflect psychologically. I think the period throughout COVID, people were very, very lonely and introspective. I mean, it's it's not actually good to have too much time on your hands to think, to ruminate, to procrastinate. We are creatures of occupation, and I think the period where we had the pandemic, people were separated from each other. They sat with the difficulties they were experiencing. They weren't able to distract themselves. They were lost. And I do think that the period of the pandemic actually caused an existential crisis for a lot of people. And what I mean by that is that they were suddenly faced with the reality of death and the fragility of human life. You know, a pandemic, it seems something so, you know, of previous generations, and the death and the fear that was attached to that. So, you
It's
know,
interesting. You touched on the point about not having almost too much leisure time because we're very lucky. If you look at the whole of humanity's existence, we're really very fortunate in that we've got the luxury of time, the luxury of leisure. When you think back just a few generations, people working their socks off around the clock just to survive, just to be able to feed themselves. They really didn't have that time to ruminate in any way. I know there's a lot of discussion in politics about trying to get a lot more people back into the workforce, either because they've got mental health issues or other things going on, because that's not good for people to be on their own day after day, perhaps financially incentivized to do that because it doesn't pay for them to go to work. So have we potentially trapped some people into perhaps potentially being on benefits and being even more mentally unwell, and not giving them the dignity and accessibility to get a job and to actually feel a lot better about themselves?
Absolutely, and yeah, the issue of welfare benefits. I'm a close follower of the news. I listened to the debate in the Commons the other day, and I did guess that we would be touching upon that. I think the benefit system has trapped people. I think when our current system was introduced by I think it was by David Cameron's Conservative government. I think it was very good, the benefits reforms he did, but they do need renewing. And so the number of young people who are economically inactive, it's really, really quite heartbreaking to experience that at such a young age. And also when that is the culture within people's family as well. It's really heartbreaking. I mean, I derive a huge amount of purpose in life and identity from my job. And I think to myself, if I didn't have that, I, I think I would feel awful. I think I would feel quite empty. And it makes me feel quite sad that people are trapped in that benefits trap.
When it comes to the increase in mental health issues, which demographics are you seeing more of that are really struggling? We've talked about young people, but are you seeing older people potentially in crisis? Are you seeing more women? Are you seeing particular ethnic minorities, perhaps migrants that have come over and are struggling from what they faced abroad?
Well, that's difficult for me to say because I only work with people, adults of working age. I mean, there are some things that I can say with certainty is that periods of life transition are naturally very stressful for people. And they tend to be the periods at either end of the age range of people that I work in. Leaving school, going to university is a very stressful time. A lot of mental health problems experienced by students at university and people doing exams. And then the other end, when people are coming up to retirement, sometimes people retire and they don't have anything to replace their 40 hours of work with, and they can find themselves getting depressed quite quickly.
What is it that we can do to fix this issue, Matthew? What more support do professionals like you need? What do patients need? What perhaps prevention do we need in society to make sure that people don't get into a mental health crisis? What do you see that's been working?
Well, I think first and foremost is the barriers or the factors in society that separate people, that make them lonely, needs to be overcome. And it might sound quite old-fashioned of me to say this, and maybe not very sort of trendy, as it were, but the institutions that brought people together, youth organisations, and I'm sure we can think of many, that give people a sense of belonging, because social interventions and doing the normal social activities of everyday life are incredibly good for people's mental health. It will help to overcome the loneliness, get people away from their mobile phones and from the gaming that they do, which are inherently sort of dissocial activities. So I think that's a big problem. But if you bring a group of people together, give them a purposeful activity, that's one of the big things we can do to help people's mental health. That's very important. Our conceptualization of mental illness throughout society, I think, is a problem, because people will say, I've got a mental illness. And very often people who say that have got a mental illness, but people don't understand the difference between having a mental health problem and a mental illness, because we all experience stress, we all experience anxiety. That's actually normal. Life does have its ups and downs, but when that tips over into mental pathology, sometimes it's something very, very different. And we overuse words, for example, or misuse words. Words like depression. When people come to us and complain that they feel depressed, sometimes their moods are low and it's in response to like a natural situation, so like grief or something. So it's knowing what mental illness is and what it isn't that's the problem, and the focus on I suppose getting diagnostic labels as well. People will very often come to us and say, I think I've got this. And our advice can be, let's park the diagnostic label and let's do a psychological formulation first. Let's look at your life history, see what's gone wrong, see what we can put right. So the focus on diagnoses and our use of language is a bit of a problem. And certainly, I suppose, at the political level, I think an urgent government review of social care is so important. I mean, I love my social work colleagues, the interventions that they provide for people, helping them to access their local communities and care and support can be absolutely life-changing. And being able to reframe care work, home care work, working in the care home and community care sector, the whole thing of a career path, of career progression, needs to be worked out, and it needs to be put forward as a respectable career. I mean, it's wonderful the things they do, being able to walk life's journey with people sometimes, doing the normal things of everyday life. It's a beautiful thing. And it's quite heartbreaking that people don't want to do that. It really is. Because if I
And do
wasn't
you
doing my job, I mean, that's the job that I would want to do. I want to be sort of taking people to have nice experiences in life and sort of building them up and what have you. That's beautiful. And people need to know that that's a wonderful thing.
And when people come to you saying, I think I've got a mental health illness,
Hmm.
a lot of the time, do you find that actually they're just going through a particularly stressful or upsetting period in their life? And actually, it's all quite normal. It might not be
Hmm.
pleasant, but they don't have a mental illness. Do you
Yeah.
find that that happens from time to time?
I do find that happens quite a lot, and as I say, it's about reformulating the issue. And because people are so isolated, they don't their benchmark for what is a severe mental health problem may be skewed, because they're not mixing with other people, they're not hearing about other people's experiences. And there's nothing like having a cohort of friends to offload your difficulties on, and people to say to you, actually, what you're going through is normal, because that's something that we do professionally quite a lot. We say, if we had those experiences that you just had, we'd be feeling pretty awful as well. So you don't need to feel different from everyone. You don't need to feel separate. It's that feeling of difference and separation and not being normal, whatever that means, that just makes things worse.
And do you find that sometimes men who don't always have those strong friendship groups that a lot of women have are the
Hmm.
ones that really struggle because there's no one they can really talk to about this, or they just don't feel comfortable talking to their wives or children about the issues they're going through?
Yeah, I think that is a problem. I mean, I remember when I was a student nurse, I did a placement at a secure hospital, and a lot of the patients there, they were forensic patients. They'd committed crimes because of their mental health problems, and a lot of them were very reluctant to go and have group therapy. And I said to my mentor, why won't the men engage in counselling and therapy? And they said, because they say it's a very gay thing to do. And it was a slightly ridiculous thing to say, or use of words. And I asked him to unpack that. And he said, well, it's seen as a very, very sensitive sort of, even feminine thing to do, talk about your problems. They're not then living up to their own image of what a man should be. Now, that was 20 years ago, and I think things have changed then. I think men are more open about their mental health problems. But I do think there's an anxiety amongst men, and I think it's especially amongst heterosexual men. I don't know for certain, that's my observation. That there are problems with feeling emasculated by bearing your soul. And it's a shame because they need to talk about the thoughts and the feelings, and it's such a weight off your shoulder. But that's why it's important that men should have that private, confidential space that they can trust. So men's mental health. I mean, it's a big area of research at the moment, and sort of exploring what we can do about that.
Mm.
Because the problem with men when they get stressed and they get worked up, if they start to feel angry and have very strong emotions, they're more likely to direct the anger outwards towards others. Women are more likely to direct it at themselves. That's been my observation. And it's like with the prison population, which is overwhelmingly male as well. The prison population are really, really struggling with their mental health. A lot of them are there because of their mental health difficulties, essentially. So yes, it's a real big work in progress. It really is.
I know that there's been gathering momentum, sort of men's only groups to be able to talk about mental health in
Mm.
a sort of informal way. And that seems to be growing. That seems to be a real positive. I
Yeah.
wanted to talk to you about social media because it is rather demonized, but it is a problem as well. It is causing mental health illnesses. We know that.
Yeah.
What would your view be on potentially banning phones in schools? What do you think that perhaps parents should do about getting phones for children, or perhaps rationing their own usage of them?
Mm.
How much do you think mental health issues do come from social media and spending just too much time on your phone?
I think mobile phones should be banned from school because you're there to learn. You're not there to socialise, and you're not there to be scrolling through things. I mean, people watch social media, especially young people, and it helps them to form their views of the world. It helps to shape their values and what have you. And I give Andrew Tate as an example of that. I've spoke to young people, young men before, and he's like, that's the man that they want to become because of his values. And I find that really heartbreaking. So I suppose my question is to parents: why aren't you talking about values in the home? Why are young people having to go to social media to find their values and what it is they really treasure in life? So I think the discussions need to be had around the dinner table as to what it is to be fully human, what it is to lead a good life, and even what it means to be a man, what it means to be a woman. Those conversations need to be had with families, within families. But then, of course, if the parents are spending most of their time on social media as well, that's going to be a problem. It's about discussion. It's about sitting around the dinner table. That's what we do in my house. We have discussions around the dinner table, and it's so valuable. Going out for afternoon walks, having a chat, children and parents asking each other what they think about things, how they feel about things, having those beautiful relationships. And then I think the need for accessing those sorts of things in social media will get less and less.
I have a final question for you, Matthew.
Sure.
If you were Prime Minister, what
Hmm.
law would you introduce or change, and why? Could be something that you want generally changed about the UK as well.
I don't know. I don't know if I would introduce a law per se. But it would definitely be in relation to adult social care, to give it more strength, more respectability, maybe to establish the social care profession more distinctly in a statute, like other professions such as nursing are, so that it can have its own respectability, and so that it can have really, really a real sharp set of teeth, as it were. I think that would be the best thing. So that it could have a more assertive voice. Social work is generally quite assertive people already, as I know, but nationally, I think they need more of a voice. And so if they were then galvanised and they were able to sort of develop their profession in more productive ways, be able to get people out of hospital quicker, that's so important. There's a lot of delayed transfers of care across all sections of healthcare. So I think that's where some legislature would do some good, I think.
And do you think it's accessible to become a mental health nurse? I know you said you begun your career doing a diploma first of all, and we know we
Mm.
need more mental health nurses, and part of that is a funding issue. but do you think that there is a clear, easy path for people to become mental health nurses, or do you think that needs to be looked at too?
I do think it needs to be looked at. In recent years, we've had something called nurse cadets and nurse associates, which is, I think it's sort of like the equivalent of the first year or first 2 years of a degree. So that's helped people to come in, which is fantastic. But it's always been something of a debate in nursing because we're very practical people and we very much value our practical wisdom. But since nursing was made into an academic subject, it was, I think it was called Project 2000 in the 90s. There's been more of a focus on academic research, so it's getting people into nursing who have got the mental clout to be able to critique research, engage with statistics and stuff, but also have the interpersonal skills as well. It's very difficult to find people, I think, who cover both of those sort of in equal measures, I think. So yeah, I mean, mental health nursing has certainly been perceived as the Cinderella service in nursing, it being very, very stressful. But all branches of nursing are stressful, and it's like anything, the longer you stick at it, the easier it gets. So there's a lot of messages that need to get out there. I think the nursing regulatory body needs to communicate what a wonderful profession it is. I mean, I've been doing nursing now for over 20 years. I would never do anything else. I love it. So we do need to celebrate the joys of nursing much more.
Of course. Thank you so much, Matthew Callow, for joining me in the Berkshire Heroes podcast. It's been brilliant to speak with you.
Thank you so much.